Hello, students. My name is Nurse Gaidosova, and today I will talk you through the most fundamental examination in neonatology. We will look at the APGAR score assessment. Is anyone familiar with this particular assessment? Yes, Mr. Podolsky?
The APGAR score is the assessment of vital functions of the newborn. The child is examined in specific intervals after birth. I think it is 1, 3, and 10 minutes after birth.
You're almost correct. We will talk about the exact times shortly. What vital functions do you think need assessment in a child right after birth?
Breathing.
Pulse.
Whether the baby is crying?
Good. All of these are very important. Can you think of anything else?
The color of the child's skin. If there were any difficulties with breathing, the child could manifest with cyanosis.
Very good. There are 5 criteria that need to be monitored in a neonate, and the word APGAR serves as a mnemonic for all of them. So, as a medical practitioner, you will be looking to assess A for appearance, or, as Ms. Uhlikova has correctly identified, the color of the skin. Then, P for pulse, G for grimace, and reflex irritability such as sneezing or coughing. Next is another A, this time for activity. This means flexion in arms and legs. And last, but not at all the least important, R for respiration. And here you should be interested also in whether the baby has cried. Let's revise it together then. A is for
Appearance.
P,
Pulse.
G,
Grimace.
Good. Grimace and reflex irritability. Is the child reactive to the environment? Has it coughed, sneezed? Next is A for
Activity and flexion of extremities.
and R for
Respiration.
well done. Now that you remember what categories you are looking for, we will discuss when and how they are examined. As Mr. Podolsky has mentioned correctly, the score is assessed at 3 different times. However, the times are not 1, 3, and 10 minutes after birth, but rather 1, 5, and 10 minutes. At each of these times, you will record the overall score for the newborn child. For each of the 5 categories, you can award 0, 1, or 2 points. Therefore, the overall score ranges between 0 to 10. A score 7 or above is considered within the normal range. A score below 7 is considered abnormal and suggests distress in the child that should be followed by intervention on the part of the health professional. The score is not necessarily a predictive examination. Rather, its role is to determine whether urgent intervention is required. Scores 3 and below are critically low and call for immediate resuscitative efforts. Now, let's look at how to assess each of the categories. To assess appearance, as a medical professional, you look at the color of the skin. If the child is pink and rosy, 2 points are awarded. However, if the skin is blue in the extremities, only 1 point is awarded, and if the skin is pale or blue overall, 0 points are given. For pulse, the optimal heart rate that constitutes 2 points is over 100 beats per minute. If the pulse is below, 1 point is given, and if there is no pulse, no points are taken into consideration for this category. 2 points are given if the child has reflex activity and a grimace, cough, or sneeze is observed. 1 point is recorded for some flexion of the extremities and some grimace, and 0 for no response. To assess activity, you look at the overall muscle tone and the flexion of the extremities. For active movement and good flexion, 2 points are recorded. 1 for flexed arms and legs, and 0 for no movement. Lastly, you look at the signs of breathing. If the child cries vigorously, that constitutes 2 points. If a slow, irregular, or weak cry is present, 1 point is recorded, and for no cry, 0 points are given. At the end, the points are counted and the overall score is recorded. Who can remember what the optimum score is? Miss Kiskova?
7 and above.
Very good. As you see, the assessment is quite intuitive. The most important thing to remember is what you're looking for, and the mnemonic serves for just that. And the last question. Do you know where the name of the examination comes from? Why is it called the APGAR score?
Isn't it because it is the abbreviation of all the monitored functions?
Yes, that's correct. However, the word APGAR is not only a mnemonic of vital functions in newborns, it is also the name of the physician who first developed this method to quickly summarize the health of children. Her name was Dr. APGAR, and she was an anesthesiologist. Now, let's continue our rounds at the neonatological ward.